It was the early 1990s, and Jimmy showed up at Healthcare for the Homeless in the middle of winter, the fourth day in a row, without any shoes. Now, I was a caseworker at the time. I could solve this problem. I could get Jimmy pair after pair of shoes. We eventually realized that we needed to go to the courthouse, which you had to do at the time, and get a judge to give us an order to declare an emergency petition and take Jimmy against his will to the hospital. And I spent 4 hours with him that afternoon at the hospital until a psychiatrist agreed to see Jimmy and admit him to the hospital for observation. I was exhausted. I walked back to the clinic, stopped for a cup of coffee, thinking about this incredibly long week and our plans to engage Jimmy, and I rounded the corner, and there in the vestibule of Healthcare for the Homeless, lying on the ground, was a barefoot Jimmy. I sat in my coworker's office and railed against a system that would keep someone like Jimmy from having access to the care that he needed. I'll never forget the response. The person listened to me, shrugged his shoulders, and then looked me in the eye and rather casually said, "Lower your expectations." Now, this was someone who was part of the very early founders of Healthcare for the Homeless. They were going to put themselves out of business within a decade. You're telling me to lower my expectations? And then I thought about it for a minute. I reconciled his words with his actions. And I realized that what he was really trying to do was to tell me to change the way I thought about success. What was I trying to accomplish with Jimmy? Over time, that relationship worked, and we got him into the clinic, and he saw a nurse practitioner. He ended up seeing a psychiatrist. He moved into his own housing. He helped us prove what we've said all along, that homelessness is not permanent. From the very beginning of Healthcare for the Homeless, from this staff of 5 to our current staff of 260 plus, we've been driven by passionate and creative people that change traditional notions of success to engage vulnerable people into care. There was the outreach worker that convinced the client that he should move to a different corner because it was nicer and had a better view. It also happened to be a half a block away from Healthcare for the Homeless. There was the social worker that decided to use art to engage vulnerable people into care. And if you've walked through a Healthcare for the Homeless facility today, you've seen colorful mosaics and sculptures decorating the walls. There was the physician who actually agreed to come out of his exam room. This physician liked to stay in his exam room and meet a woman on the corner until he could eventually engage her to come into the clinic and to get into the care. Along the way, 2 things have been constant. Number one, we start where the client is to engage that person into whole person care, even if it means going to where that person is. And secondly, homelessness is symptomatic of poverty. It's not a characteristic, it's an experience, and it is not permanent. We've also wrestled with 2 fundamental questions. During the very first strategic planning process of Healthcare for the Homeless, we debated as an organization for a year. Are we a service organization? Do we exist to provide the best possible care we can to vulnerable people? Or are we an advocacy organization? Do we exist to change the public policies that create homelessness faster than we can stop it? The answer then and now was yes. The second question that we've wrestled with had to do with healthcare or housing. Are we a healthcare organization? Are we a housing organization? In the early days, we kept those 2 concepts pretty separate. But we all know what happened over time. We found, against conventional wisdom, that when we put people into housing right away and gave them the care that they need, they tended to stay there. Their health tended to improve. This formed the basis of our existing supportive housing program that's helping hundreds of people each and every year. During this most recent strategic planning process, we answered that question a little differently. Are we a healthcare organization or are we a housing organization? When we realize, when we've learned from our experience, that housing is in fact healthcare. We answered that question by saying it's not that we're in the healthcare business, it's not that we'd be going into the housing business, it's really that we're in the ending homelessness business. That moving more into the area of permanent supportive housing is an expression of the mission that started our organization 3 decades ago. And so we enter into a very bold strategic plan that has 3 goals. One, that 100% of the people that we serve are going to have access to healthcare and housing. Secondly, that we're going to figure out sustainable models for housing production. We know it's not available for our clients, and for the services that people need to stay stably housed. And thirdly, that the health outcomes of those that we're serving are going to rival those of a stably housed population. 3 big, gigantic, bold goals. In the early days of healthcare for the homeless, people thought they were going to put themselves out of business within a decade. That really came out of their first strategic planning process. Think about what came as a result of that bold vision, of a group of people that stretched so far that they thought they could put themselves out of business. From a 21st century perspective, we could say that that effort was a failure, or we could recognize that we are very much carrying on the work that they began. Those 5 people that started Healthcare for the Homeless, or the 20 people that moved from Liberty Street into Park Avenue, or the 120 people that moved into Fallsway, they would not be able to recognize the organization that we've become today. But I guarantee you, they'd recognize our values. I know that they would see in your work their own earlier endeavors, and I'm pretty sure that they would recognize themselves in you. Homelessness is not permanent. Let's prove it.